As a parent coming in, we obviously were like upset. We lived almost in trauma for a couple years because of how Johnny was acting and behaving, and it was really challenging as a family. So because he sees this every day in his work, he almost normalized it for us, and I think that was really helpful. We felt so different from other families, and from other families we didn't have to worry if their kid was gonna, be set off at the store, or we were gonna have people over our house and Johnny was gonna have an episode. Like, it was hard for us to kind of feel normal in our group of friends, but to go to someone who normalized it for us and said, like, this is gonna be okay, like, I can help you, I can do this for you. It was really great. Hi, my name is Adrianna Tuomi. I am from Manchester, Connecticut. So my son, Johnny, who is 7 years old, at about, I would say, when he was like 3 years old, we started seeing a change in his behaviors. It was not so much an overnight shift, but we started noticing that he had some OCD tendencies. His behavior started to go almost from 0 to 60. He would be verbally aggressive. He would be physically aggressive to his older brother, who is 4 years older than him. We just noticed some very odd behavior changes in him that we had not seen from birth up until about 3. He had a lot of strep infections, and when I say a lot, it was several over the course of each year. I think he had 11 one year. We did not connect the two. We just were kind of like, okay, he's sick, his behaviors are really off, but we just dealt with it as a family for a good 2 or 3 years. He started to have also a lot of sensory issues, like his clothes started bothering him. He was a little bit strange with food, no food restrictions, but definitely had some interesting eating patterns. So with all of these things happening, we're like, something is going on. So I am a mental health professional. I'm a therapist. We worked with a therapist on his behaviors. I brought him to a doctor who prescribed psych medications. We started him on an anti-anxiety med because they thought maybe it was mental health based. But even those providers were like, this is something more than that. So then I kind of went down the route of Googling of all this stuff that was happening with him, and I read about pandas. In the mental health world, we have seen it in the patients that we work with, but I just didn't connect the two. After that, I went down a search of providers, and that is where we found Dr. Moorcroft. When I reached out to his office, there was just a lot of comfort that I felt knowing that this was something that he had treated. I had looked on his website. We just felt very comfortable, even from that initial appointment, the way that he engaged us, engaged my son, Johnny, because it was virtual, which can be really challenging to engage in that platform, but we just felt very comfortable from the start. Looking at the cost, we did have to weigh, okay, do we go with Dr. Moorcroft, or do we find someone who takes our insurance? And I think for us, we went back and forth a little bit, but then we decided, obviously, reading the testimonials, about him and the care he's provided to his clients, we said, you know what, this is our child, and I would do anything to help him, to make him feel better. Dr. Moorcroft had put him on like a maintenance dose of azithromycin, and he's been on that for like 5 months maybe, and we are stepping down the azithromycin dosage to just 3 times a week until he finishes this prescription. And the reason why we're able to do this tapering dose is that Johnny is doing really well. We don't see any more of like the night terrors, the OCD, the vocal tics. All of that is completely gone, which I am so grateful for. Johnny he's a little spitfire, so I think some of those like 0 to 60 behaviors are still there, but they're very muted. Like, he still gets upset about stuff, but it's within the normal kind of reaction of a 7-year-old rather than being this extreme, intense thing that might last 45 minutes. So his reactions are age appropriate. Taking him out somewhere, I don't worry if he gets overwhelmed or I have to say no to him. He's going to have what we call like an episode, or he's going to escalate. I don't worry about that anymore. The relationship with his older brother has strengthened because Ryan did not like spending time with Johnny. So I would recommend him for several reasons. One, his demeanor and his like bedside manner, so to speak, is very calming. It's very reassuring. When you sit with him for an appointment, you know that he's giving you the fact. He knows what he's doing. He's done this. He's been down this road before. He guides the treatment, but he lets the parents really decide where you want to go.